extremely harmful to ourselves and extremely wasteful to our health systems. Because we focused on we need to build the technology and we didn't actually realize the thing that actually had value was the data. And so as a result, we invested in technology highly fragmented, or rather, the technologies themselves were fragmented, but we invested in technologies without consideration for the data, and as a result, the data were significantly fragmented, and our ability to create coherent stories about patients for integrated health for a person to create better health diagnostics is very challenging. Our ability to create data and analytics about population, a significant new administrative data burden of pulling the data together, ensuring the data is of good quality, and we're just starting to unpack that now, which is frankly a big part of why the movement is first. Point is that if we and this really goes into why I would dare say the data first. I'm going to use my term, data today, AI tomorrow, makes a lot of sense because if you don't address the fragmented data foundation that we have accidentally created, or if we're in a new and emerging economy, we're at risk of creating, then we're going to create AI solutions in the same way, in pockets that are unable to scale, unable to be shared, and the benefit of AI will be massively inequitable and expensive. And so we will neither achieve the promise of AI nor will we achieve a level of equitability of AI unless we get our data foundations in order in the first place. So, all of this to say, it's very much along the ecosystem. We need to bring together the tools and technologies. We need to bring together the data and our ability to turn the data into analytics in an effective way. And in many ways, that is like our services that we have in our homes, so pipes, water, and taps. And so where the pipes represent the technologies that carry the water that are interoperable and have appropriate mechanisms to make sure that they're there. And then taps actually extract the value, which is the data from those systems. And you can envision if you are missing one of the pipes, water, and taps, then you either have pipes that explode, you have dry pipes that have hot air, or you have mud. You're missing something in all cases. So you actually really do need to orchestrate all three of those things together. And importantly, the people or the thing that orchestrates all three of those things, the pipes, water, and taps together, are humans. And so we need humans to be setting the standards and overseeing the system and evolving the system in and of itself to improve the quality of the flow of the pipes, water, and taps. People got together, including Alexander Graham Bell and Thomas Edison and others, and they recognized the value of electricity was too important for humanity for people to be arguing over, what the standards were going to be around. And eventually, through their work, they created the IEEE. They created the predecessor to the International Society of Electric and Electrical Engineers. So, and that is a body that sets the standard that ensures safety for the production and distribution and consumption of electricity. And so what they were able to do through that, they were able to facilitate, there is a competitive space for the creation of electricity. There is a competitive space for the consumption of electricity, but the distribution of electricity, that is non-competitive. These are the standards that we're going to follow. And the reason why that's non-competitive is because the value of getting electricity to the people who could use it in a timely fashion is too important for humanity. I don't actually mentally know. I think access to water is considered a human right. I do not know if access to electricity is considered a human right, but arguably it could be. I know there's arguments about whether or not access to the internet is a human right, but that's another story. And so in the same way, if we want to be driving our AI initiatives going forward, we need to be thinking about what are the non-competitive spaces where governments need to be cooperating together, and the public sector and the private sector need to be cooperating together to lay down common foundations that everyone agrees these are the foundations we're all going to be working from. And then based on that, then you can innovate, and innovate, that's where you express your competitive advantage. The problem is that within health, we have set up health to be a competitive environment from top to bottom. Great guidance in this space and make their mark. It's actually creating so much noise that the decision makers in countries are either they're certainly not taking the very clear action that they must in order to move forward boldly. What they're doing is they're like, well, I heard this from the World Bank, I heard this from the WHO, I heard this from the OECD, I heard this from this think tank over here, and this is what my experts in my country are telling me. I don't know what to do. I'm just going to do the easiest thing, which is I'm going to put up my walls and build my solution for myself. And so, and that is human nature. I don't disparage it. And so it's the recognition that there is actually more value to come out of AI through cross-border collaborations. And I would dare say the opposite of that statement. There is likely to be harms that countries will bring onto themselves if they choose not to collaborate. But those harms are going to be in the long term and not as obvious to see. And frankly, in a world where everybody is saying, deliver something for me yesterday, which is kind of why the data now AI later movement got started, because there's this, I'll say there's a healthy impatience toward action, but it's becoming a unhealthy impatience toward action because it's action at the expense of the foundation. I think a large part of it, and this again is where I do very much align with the ideas in this and data now AI later, but and this is actually one of the comments that I made when I sent off to you guys. Let's actually make reference to those foundational things that people should be adopting. Recommendation to health data governance. We published it almost 10 years ago. It's mature. And I've been looking at it, and it's like, yeah, it's pretty solid still. Like a little bit of interpretation here and there about what it means. But why would we not be conscious that let's build on the foundational things that we've agreed on? Things like here's what our approach to health data governance should be. Here are what the technical standards that everyone are adopting. HL7 Fire, but beyond HL7 Fire, because frankly, it's not near useless. It's just, it is defining your bus without defining who is actually allowed in the bus. So looking at the International Patient Summary, and everyone should be that, and we should actually develop the semantic standards associated with that. We should actually be looking at what are the arbiters that enable us to be able to collaborate effectively in federated data networks. And a big part, so I think it's health data governance in terms of the guardrails. I think it's the standards and standards semantic technically in terms of like getting the pipes actually working and getting the data actually flowing. But I think it's also what are the legal agreements around that trying to do something that is just, public health interested. I don't need to be signing 100 data sharing agreements with everybody individually because we all signed up with one center. And so how can we better administrate these systems to simplify the processes associated that facilitate data access while still ensuring its protection? But the tone that we've been taking in a lot of OECD countries has been we must protect the data. And after we've protected the data, then we can see what access we can allow. We need to change the conversation and we need countries to come together. And this is really the understanding of what a trusted network would achieve. We need to allow access to the data, and in allowing access to the data for a legitimate purpose, we will ensure that when we provide that access, it will be appropriately protected. So we will provide access with protect as opposed to protect the data and then worry about what access you can get. Mm-hmm. And the order of operations there is not commutative. Access with protections, you get a lot more data than you do with protections and then access. So saying the genie is out of the bottle, so to speak. It's not like choice about do we do AI or not. It's how do we do AI in a way where we are responsibly adopting AI. And we're at a point where we haven't actually defined what that is. We're adopting AI on an ad hoc basis, on an opportunist by people who actually have the money and the risk appetite in order to afford it. So as a result, what's going to happen is, without any interventions, is that the well-funded institutions who have a risk appetite will implement AI solutions, make it available for their populations. People who have access to those institutions will be able to receive benefit from AI. People who do not have access to those institutions will not. And so that means that the people who are inequity in two different ways. Inequities because I happen to be living in the wrong part of a country, or I'm in a rural part of the country versus an urban part of the country, and I don't have access to it. And there's also a divide in terms of the countries that have, like countries themselves that are able to afford to have well-funded institutions. So it's where the higher income countries, the OECD, certainly many of them have well-funded hospitals, and whereas in sub-Saharan Africa, they probably don't have as much spare money and their risk appetite is less. So, and thereby their ability to do this work is hampered. There's the other challenge that AI itself, when people say it, there is a significant fear of AI. Is this going to replace my job? Is this safe to use for healthcare purposes? And frankly, a lot of people say no. We have to know more before we start. But the reality is, while we're working out, is this safe to use or not? People who have a higher risk appetite are using it anyway. And so, and those solutions that they are building are going to become entrenched. And then we're going to run into the same inertia problems that we have when it harms all of us, because if one country is a hotspot of COVID, then unless you put walls around that country, we're at risk of everybody actually being affected in and of itself, which is why we race towards getting a vaccine for everyone. It was in the global public interest in order to do this. I don't think we've recognized yet that AI is something that is in the global public interest.
But data can be.
But data can be, and this is where I actually gave an interview with The Economy, and I chastised them. Because 10 years ago, the cover of The Economist was data is the new oil. What's the behavior you have with oil? hoard because oil has value when I keep it and I can charge a lot more money for it. Data is not like oil. Data is more like water or electricity, only has value when it is actually used, whereas oil has value innately when it's actually sitting in place.
Good. Yeah.
And so we have to provide access to data in order for it to be useful, but that is not the culture that we have fostered in the last 20 years. And so the foundational thing, the thing we actually have to start with, and so this is where I'm going to change what we talked about altogether. It's not about data first and AI later. It's about first. Data tomorrow, AI later.